Hello guys and gals, I am your student nurse Shania Kilisadio from Visayas State University, and today we're talking about urinary retention. Urinary retention. This is the inability to empty the bladder completely during attempts to void. This can be acute or chronic. Chronic urine retention often leads to overflow incontinence from the pressure of the retained urine in the bladder. Residual urine is urine that remains in the bladder after voiding. In a healthy adult younger than 60 years of age, complete bladder emptying should occur with each voiding. In adults older than 60 years of age, 50 to 100 ml of residual urine may remain after each voiding. This is because of the decreased contractility of the detrusor muscle. Urinary retention can occur post-operatively in any patient, particularly if the surgery affected the perineal or anal regions and resulted in reflex spasm of the sphincters. General anesthesia reduces bladder muscle innervation and suppresses the urge to void, impeding bladder emptying. The causes of urinary retention are the following: diabetes, prostatic enlargement, urethral pathology by infection, tumor or calculus, trauma or pelvic injuries, pregnancy or neurologic disorders such as stroke, spinal cord injury, multiple sclerosis, or Parkinson's disease. Some medications may also cause urinary retention, either by inhibiting bladder contractility or by increasing bladder outlet resistance. All of these can cause decreased contractility of the detrusor muscle, which leads to residual urine. Diagnostic procedures for urinary retention includes the following: medical history, physical exam, cystoscopy, imaging tests, urodynamic tests, and residual urine measurement. Laboratory procedures include the following: urinalysis and blood tests. Treatment modalities for urinary retention: draining the bladder, immediate drain for acute urinary retention, treatment for underlying cause for chronic urinary retention before draining the bladder, medical management, 5-alpha reductase inhibitors, alpha blockers, combination of a 5-alpha reductase inhibitor and an alpha blocker, antibiotics, cystoscopy, laser therapy, prostatic urethral lift, transurethral electrovaporization, transurethral water vapor therapy, urethral dilation, and vaginal pessary. The following are surgical managements: removing part of the prostate, repairing urethral strictures or bladder neck scar tissue, repairing pelvic organ prolapse, removing a tumor, abnormal uterus, or damaged portion of a herniated disc, repairing an abnormal bladder, performing a urinary diversion procedure to reroute the normal flow of urine out of your body. The following are nursing managements. The first nursing management is promoting urinary elimination, providing privacy, ensuring an environment and body position conducive to voiding, assisting the patient with the use of the bathroom or bedside commode, applying warmth to relax the sphincters. For example, sitz baths, warm compresses to the perineum, or showers, giving the patient hot tea, offering encouragement or reassurance. Simple trigger techniques, such as turning on the water faucet while the patient is trying to void, may also be used. The second and lastly, nursing management here is promoting home and community-based care, patient education. One should teach his or her patient to follow the following: Increase awareness of the amount and timing of our fluid intake. Avoid taking diuretics after 4 p.m. Avoid bladder irritants such as caffeine, alcohol, and aspartame. Take steps to avoid constipation such as drinking adequate fluids, eating a well-balanced diet high in fiber, exercising regularly, and taking stool softeners if recommended. Void regularly 5 to 8 times a day, about every 2 to 3 hours. First thing in the morning, before each meal, before retiring to bed, and once during the night if necessary. Perform all pelvic floor muscle exercises as prescribed every day. Stop smoking. Smokers usually cough frequently, which increases incontinence. Prognosis. With acute urinary retention, a person cannot urinate at all, even if they have a full bladder, and is a potentially life-threatening medical condition requiring immediate emergency treatment. Chronic urinary retention can be a long-lasting medical condition. However, if treatment of the underlying cause is successful for chronic urinary retention, the prognosis of the patient is good. That's about it. Thanks for tuning in. Once again, I'm Shania Calisadio, a student nurse from Visayas State University. Bye!